all, I was talking about it at the top of the show. COVID-19 is still something on everyone's minds, but it's not the only chronic health condition we really should be worried about. If you have a chronic illness, how can you make sure that you still get the help that you need? Well, a lot of healthcare industries are now going virtual, and here to talk more about that is friend to the show, Dr. Jeremy Wigington. He is the medical director for Blue Cross and Blue Shield of Louisiana. Doctor, welcome back to the show.
Appreciate it. Thank you. Glad to have
I
that.
am glad you are here because you are always giving us great information. I want to start off with a story that WWL TV actually ran earlier this week, talking about how coronavirus possibly can now be spread through our eyelids. You know, we're covering our noses, we're covering our mouths with the mask. What can you tell us about that information?
Sure. Well, actually, several different things can be spread through the eyes. Some bacteria and other viruses can actually be spread through the eyes. So, much like the mouth and the nose, it is an opening into our body. And so, we know that the coronavirus and the disease that causes COVID 19 is spread through water droplets in our breath, if we sneeze or cough, especially because it can spray those droplets out. And those droplets then can get in other people's eyes, and that could be a possible way that coronavirus is spread. While we don't quite know exactly how contagious it is via the eyes, we do know that's a possibility, the way that it can spread. So, wearing those masks is very important, not only to protect yourself, but to prevent the spray of those droplets out that can get in others' eyes.
Really important. Protect yourselves. Very important. Now, coronavirus still a very important topic that people are still talking about. But what are some of those other chronic illnesses that people should still be worried about?
Sure. Don't forget that just because we have the coronavirus pandemic, that you or your loved ones may have other chronic conditions such as diabetes, high blood pressure, heart disease that still need to be taken care of. So, first thing you should do is talk to your regular doctor or a regular specialist, whoever's been keeping up with your care about your chronic health conditions and exactly how you can keep up with them during this pandemic. And as you had mentioned, telehealth is a very common way now that we can see our regular doctor specialists so we can keep up with those things. And so it's very important not to forget our chronic issues or even new issues that may occur. And so telehealth is a good way to do that.
Yes, you're seeing some information about telehealth right now. How does it work?
Well, telehealth is very easy, actually. All you need is some way to interact with a microphone and camera and internet or cellular service if you're using, say, a smartphone. It's very similar to an in person visit. You're going to see and hear the provider. They should be able to call in or send prescriptions electronically. Usually, it's about the same amount of time as a regular visit. And do those things that you would with a regular visit, making sure you're making a list of questions or concerns before the visit and always following their advice to the T.
Very true. And I love how you want to make sure you have a list of questions before the session begins. That's a really great tip there because at the end of the day, telehealth does do a lot for us, but there are some things that you may forget while you're in the middle of your conversation with the doctor. So having some notes written down is always a good thing. But say I'm having an emergency, what do you suggest doing?
Well, don't forget the emergency rooms are not closed, and facilities are taking great care to prevent the transmission of all contagious diseases, not just COVID 19. So, if you're having things like chest pain or signs of a stroke or severe abdominal pain, any of those things that you consider to be emergent and you need to see someone right now, don't forget the emergency room is still open. And also, if you have a regular doctor, if you're having any symptoms that are concerning to you, get in touch with your regular doctor and talk to them about it. The third option would be that if you're not quite sure, reach out and see what your telehealth options are, especially starting with your regular doctor or specialist to see if they have a telehealth option for you.
And no matter if you are having an emergency or just going to the doctor for some reason in person, you want to make sure we still wear the mask, right?
Exactly. We're not just protecting ourselves with our masks, we're protecting others as well. So everywhere we're going, make sure to follow the businesses guidelines, your state and local guidelines about, around wearing a mask because it is for everyone's safety. If only one person wore a mask, it wouldn't work too well. So it really relies on everyone following the rules.
Stay safe, my friends. Well, hey, if you want more information about your telehealth options, go ahead and visit bcbsla.com/telehealth because it is a great resource. All right.